but we're talking about childhood apraxia of speech, and for that we use the term CAS. This was very controversial for a lot of years because there is no biologic marker. You can't do a blood test or something. And even the neuroimaging work that's been done most frequently doesn't show any of the inefficiencies in motor planning and programming. So we have to rely on speech characteristics in order to diagnose. Very similar to autism, where there's a list of characteristics that are associated with that label. We do the same thing in childhood apraxia of speech. And over the last number of years now, clinical researchers and clinicians have really come to agree fairly consistently about those characteristics that are discriminative. That is, the characteristics that children with CAS frequently exhibit, but children with other types of speech sound disorders typically do not. Things like vowel distortions and prosodic deficits and consonant distortions, not just substitutions. Those kinds of things are often seen in children with childhood apraxia of speech. And they're listed in a number of different publications now. And many people are using a number of these characteristics to differentiate the children, or to say, okay, this was our participant population in this study, and this is why we say they have CAS. So I'm happy now that there is more of a consensus of what these are. The important thing to note here, though, is that childhood apraxia of speech doesn't occur by itself. Because of their motoric difficulties, they always have trouble with phonologic development. So, and some children just have inefficiencies in both of those types of processing. So the clinician has to determine what's the primary problem right now. And for the very severe children, it's frequently the CAS. And so we treat that first and then bring in phonologic and language treatment as the child gets more verbal. So that was a long-winded answer, but it's a complicated question that you asked, but a very important one. We have to be able to distinguish these children that have this type of inefficiency, this motor programming inefficiency, in order to plan the appropriate motor-based treatment for them. And what I've learned over the years, many children who have come to me have had only treatment for phonology, or the development of the sound system for their language. And because they weren't treated to focus on the issue, which was a motor programming impairment or inefficiency, they made very little progress. So it's really important to be able to distinguish these children that have at least some level of inefficiency in motor programming.